Careblazer, today I want to talk about something that catches many caregivers off guard. You're caring for someone with dementia, and things may have been changing slowly, but then suddenly they stop walking, they stop talking, they can't stand up anymore. They're having a lot of urinary incontinence. They become drastically more confused almost overnight. They lose abilities they had just days ago. And most caregivers don't immediately think, oh, perhaps something medically is wrong. What tends to happen is they have thoughts like, did I miss something? Did I wait too long? Is this somehow my fault? And questions caregivers ask me a lot in this situation is this just the dementia? Is this another stage, or did something else go wrong? Today, I want to answer that question using neuroscience, geropsychology, and real clinical experience. By the end of this video, you will know how to tell the difference between expected dementia progression and a medical red flag, and how to advocate when something does not feel right. We recently heard from a Careblazer whose husband was diagnosed with frontotemporal dementia. One day, she realized something did not feel right. He had been sitting in his chair for 2 days, no fall, no injury, no complaint of pain. She kept saying, nothing happened. I just walked into a room and something was different. Suddenly, he couldn't walk anymore. He couldn't stand anymore. He never regained that ability, and currently he lives in a care facility. Her question was heartbreaking and very reasonable. It was basically, can dementia really cause something like this to happen so suddenly? And here's the honest answer. Sudden, drastic changes like this should never automatically be assumed to be the dementia progressing. Yes, dementia is a progressive brain disease. That means the skills a person has decline gradually, unevenly over time. You might see their changes in memory, judgment, language, their ability to move their body. But dementia does not typically cause a sudden, abrupt change that leads to many losses overnight. Typically, that is a sign that something else is contributing. So when a caregiver tells me they were walking and all of a sudden they weren't, or they were talking and all of a sudden they stopped, that raises a red flag. A simple rule to remember is this: gradual change fits dementia. Sudden change requires investigation. A sudden decline often means the brain is under acute stress, not just chronic gradual neurodegeneration. Here's one way to think about it. Dementia is like a system already running with very limited reserve. And when something new hits the body or brain, that fragile system can collapse quickly. That's why caregivers often say things like, it felt like everything changed overnight. It does not mean you have missed something obvious. It means something additional has likely happened. There are 4 common contributors for sudden decline in dementia. The first one being infection, urinary tract infections, pneumonia, skin infections, especially in older adults, can cause sudden confusion, immobility, being lethargic, even hallucinations. Sometimes this happens without fever or without obvious pain that they're talking about. To the caregiver, it can just look like the person is not themselves. They seem worse. Another common reason for sudden decline is stroke, or TIA. TIA stands for transient ischemic attack, and it's commonly referred to as a mini stroke. For those kinds of stroke, maybe the changes aren't so dramatic and obvious, but whether it's a mini stroke or a stroke, it's going to affect balance, coordination, movement, and a person may simply stop standing or walking. Third common contributor is medication or medication side effects. New medications, a change in the dose of medication, or even combinations of certain medications can cause increased tiredness, weakness, confusion, loss of balance. This is actually extremely common and often overlooked. It can also apply to medications over the counter, not just prescription medications. Number 4, dehydration or electrolyte imbalance. This can cause significant changes and increase in confusion, especially if somebody already has dementia. Number 5, pain. A lot of people with dementia might not be able to communicate that they are in pain. They might not even be able to point to what hurts. And so hip pain, back pain, joint pain, fractures, constipation, all of these things can absolutely lead to increase in agitation, immobility. Maybe they're no longer wanting to move because it hurts so much, or simply withdrawing from their surroundings. And finally, prolonged sedation, prolonged immobility, basically rapid deconditioning, where somebody has been sitting around for most of the day, that the muscles start to deteriorate. Prolonged periods of sitting or bed rest will result in significant muscle loss, and that's going to impact their ability to do their basic tasks. Now, the reason I got the idea for this video is that there was a particular Careblazer who was telling me about her husband with frontotemporal dementia, and that does progress quite differently than Alzheimer's type dementia. With FTD, it often affects their initiation, their motivation, their motor planning, their awareness of their body parts. That means a person may not initiate standing or moving on their own, even though their muscles still work. So this is really important, especially with FTD, is that a person may lack the initiation, meaning they might lack that getting started, but it doesn't automatically mean they no longer have that ability. Basically, loss of initiation looks like loss of ability, but it is not the same thing. No matter what kind of dementia a person has, a sudden and complete loss of mobility should absolutely prompt further evaluation. Just because a certain type of dementia, like frontotemporal or even Lewy body, is associated with variability and being a bit unpredictable, it doesn't mean to ignore red flags or to ignore any sort of inkling you have that there might be something else going on. Now, here is the key and the big struggle for many caregivers. Many caregivers, when they bring up concerns, they're often met with something like, it's just the dementia, this is expected, this is the next stage, there's nothing we can do. Basically, it's like a form of diagnostic overshadowing when new medical issues or problems are just contributed incorrectly blamed on the dementia. It leaves caregivers feeling confused, dismissed, guilty, unsure about whether they should push back or not, because of course the healthcare providers have all of the knowledge. So if you've ever found yourself wondering, am I overreacting? No, you're not. If you need one sentence to hold on to, it's something like, this is a sudden change from baseline, and I'm concerned something medical is happening. Your instincts matter. In fact, I remember a story when I was in training to become a specialist in geriatrics. My supervisor at the time, her mother-in-law was hospitalized, and her mother-in-law, when she was hospitalized, was not able to move, not able to walk, kind of basically lost her ability to function. And the doctors basically just assumed, oh, she doesn't have this ability, she needs to move to a care facility. And my supervisor had to specifically let those doctors know, before my mom came into this hospital, she was able to walk. She was able to walk and move around. So this is not her baseline. Something more is happening. She really had to advocate to let those physicians know this is not normal, because they're an expert in the conditions in the medical field, but they are not an expert in your loved one. They don't know your loved one's baseline, especially if we're talking about somebody being hospitalized or going to an emergency room where your loved one's primary care provider isn't that main point of contact. So what should you do if you notice a sudden decline in your loved one? Number one, document the change. When did it start? How did it change? What could they do before that they are no longer able to do now? Number two, contact their medical provider immediately. And when you do, use clear language. This is a sudden change from their baseline. Number three, ask for a full medical evaluation. The doctor will likely include labs, blood tests, imagings, a medication review, infection screening. That's what we're looking for here, asking them for a medical evaluation. Finally, don't accept that this is just dementia. Don't accept that explanation when there has not been any exploration or evaluation of other causes. If you feel like you need to maybe push back a little bit or advocate, you can say, this change was abrupt and not consistent with their usual progression. Fast action does matter here, especially if there's an underlying medical contributor causing. Some of the causes are time sensitive: infection, stroke, medication side effects. These will worsen if they go missed. And even if the decline can't be reversed, identifying the cause can help reduce suffering, improve their comfort, and prevent further harm. And if you are carrying guilt that maybe you should have caught this sooner, brought this up with your loved one's provider sooner, I want you to hear this. You did not fail. You did not cause this. You are trying to respond and care for a disease that is already hard to interpret. Dementia makes the entire medical picture blurry. So if your loved one all of a sudden stops talking, stops walking, stops functioning in the way that they were, and it is dramatic, sudden, significant, noticeable, almost overnight, pause, pay attention, ask more questions, and say something. Absolutely, dementia progresses, but sudden decline deserves further investigation. Advocating for that does not make you difficult. It makes you attentive. You are not imagining things, and you are not alone in this. If you'd like to stay in touch in between our weekly YouTube videos, there are some links below in the description where you can sign up for our free weekly Dementia Dose newsletter. I'm sending you so much love. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.